All right. So good morning on behalf of UNICEF at the Press Institute of India. Let me extend to all of you a very warm welcome. We, of course, met each other before at the Press Institute, some of us, and we've also met online on webinars. Also, let me wish all of you a very happy New Year.
Same to you.
Let's hope there will be good health and peace of mind and happiness, and somehow or the other we get through what has been an extremely tough 2 years, starting with 2020. When the first variant arrived, we were all caught unawares, and it was quite frightening. And even much later that year, as we were looking at coming out of it and looking for a brighter 2021, we were hit again by the Delta variant. And then that, of course, we know the kind of toll it's taken on people, on institutions, on our entire, mindset, and the struggle for oxygen and beds, pictures that will remain with us for a long time. And even as 2021 was coming to a close, and we were looking at a brighter 2022, we still hope will be bright, along out of the blue arrived the Omicron virus, and that's again set us back. And even as we speak, although there is a dip in cases, I think the last couple of days overall in India, but we have still a long way to go. One of the major issues, and which has really not been spoken much about, as we all know, is the impact that the COVID pandemic has had on children. And it's not just about not being able to attend schools. You have small children at home, you have adolescents and others who are not able to communicate, who are not able to meet their own friends, who are not able to go out and play. The whole, system of being there with the teacher in class, interacting, playing on the field, all seems to have disappeared. And even as we saw rainbows, come up and, schools opening up a bit. In fact, we had a webinar last year, I think in October, when we were speaking about schools reopening and the SOPs that had to be followed. But now with this virus, schools are closed again. The whole, education system, as we know, has gone for a toss. Exams are being postponed, board exams postponed, etc. And so we don't really know the kind of impact this has had and is still having on children. We'll talk about some of these issues as we go along. The only recent developments, of course, one of it has been the opening of vaccinations to children who are above 12 years. And we will have UNICEF speak about that. And we will also look at some of the solutions as we go ahead, or what can be done to make the lives of children better. We are still in a COVID year, and we hope that we will, reach the end of it sooner than later. So let me introduce each one of you, starting with Sudha Umar Shankar, who's a senior freelance journalist who's written, of course, for various newspapers, including the Times of India, the Hindu, the Indian Express, and I think Deccan Herald and the Deccan Chronicle. Susan Phillip, who's spent years at the PTI at the desk, editing all kinds of copy. And she fortunately works for us now, the Press Institute of India as editor, and she also edits for the Deccan Chronicle. Manjara Mazumdar from Kolkata, good to have you. It's always good to have an opinion outside Chennai, some view from, from outside Chennai. Senior journalist and researcher. She's, of course, a lecturer at the Print, Medium and Text Journalism at the Media Science Department of the Heritage Academy in Kolkata. And she's, of course, earlier worked for the Indian Express, a group of newspapers, and written also for the Telegraph, the Statesman, and the Times of India. Padma Priya is the chief executive of Sanitation First. It's an organization that works in association with the UK organization. She has, of course, worked in management roles in organizations such as CARE, Save the Children UK, and the British Council. But more importantly for this meeting, she's done some wonderful work in corporation schools, in rural Tamil Nadu over the past 2 years, especially in the area of hygiene and sanitation. And that really is her specialization of designing programs which cut across health, hygiene, and education. Nandini Sridhar, storyteller who tries to bring out the creative abilities in children. She's also a special educator who works closely with children with the learning disabilities. Nandini is here more in her capacity as a parent and someone who is extremely passionate about issues relating to children. Ragini Srinivasan is a counselor with almost 3 decades of experience in counseling and training. She counsels students, adolescents, parents, teachers, young adults, couples on aspects such as stress, anxiety, depression, self-esteem, confidence, also dealing with trauma, managing crisis, relationship issues, professional, personal issues, study habits, etc. So good to have all of you. And also thank you all very much for readily agreeing to be a part of today's program. Let me also introduce the team from UNICEF. First, of course, Sugato Roy, who has been a close friend and, of course, a colleague, I would say, the past 10 years. He's been communication specialist with the UNICEF team in Tamil Nadu for many years and recently moved to Bhubaneswar, where he's now the social and behavior change specialist. I must mention that it is Sugato who's really who's been driving and taking the initiative for these sort of programs, and I must thank him for it. Warm welcome to Kaushik Ganguly of UNICEF. He's a child survival specialist. He works out of Chennai. And a warm welcome to Dr. Arul Anand, who is a UNICEF consultant who also works out of Chennai. So what we will do is we will first have Dr. Arul Anand speak about the COVID-19 variants and the vaccines. And after that, Kaushik will speak about how we can break the chain of transmission of the COVID vaccine. And once they are done, we will open it up for discussion and we'll have all your views. All right. Dr. Arul Anand, over to you.
Yes, thank you, sir. I'll share my screen. Good morning. Good morning, sir. I'm audible?
Yes, you are. Yeah. Please go ahead.
Okay. So today that's we're going to talk about the COVID-19 variants and the vaccines and the small status situation in Tamil Nadu about COVID. So my slides are visible?
Not yet.
The slide hasn't started yet, Dr. Arul.
So now?
No,
Screen is paused. 1 minute.
it's not coming. Can you retry it again, please?
Switch off your video, Arul,
Yes,
and
sir.
then share the screen. Maybe bandwidth issue.
Okay. Yes, sir. You can see symmetry.
Yeah, we can see, doctor.
It's not moving. Okay. So we all already know about the COVID-19 pandemic started from Wuhan in China. So this WHO definition that most people infected with will have a experience from mild to moderate respiratory syndrome, then move on to get very sick with COVID and become seriously ill or die at any age. This is the introduction. So what is this? The pandemic progress and virus evolution right from 2022 now. It's all virus, including SARS-CoV virus that are can evolve, can evolve from time to time. Most changes do not know impact on the virus properties. However, some changes may affect the virus properties, such as how easily it spreads. So every changes evaluation can assist with how easily it can increase its speed, increase its severity or virulence. The performance of vaccine can be affected. Therapeutic medicine can change. Diagnostics tool, whether it could be detected or not, anything will have an impact on this evolution. So what we have about mutant and the variant. So viruses are constantly evolving and changing. Every time a virus replicates to make a copies of itself is a potential for change in its structure. Each of these structures is called a mutation. When more or mutation occurs in the same system, it's called as a variant. Some mutation can lead to changes in important characteristics of the virus, as already we have termed it. So who
Can you make
is
it full screen?
full screen, sir? It's not
Yeah,
coming
yeah.
full screen.
Just click on the slideshow and make it full screen. Yeah, you can click that.
The slideshow has come.
Yeah,
Yes, sir.
that's full screen.
So who is the WHO is the responsible for the monitoring of the change to the virus and is continuously monitor the evolution and various mutations and variants. So it looks for the potential signals and the potential gives us a variant of interest or variant of concern. So every the nomenclature mostly is given by the GSAID and the NextRip and the Pango, which are the scientific which used by the scientific community and for having a genetic linkages for this. Whereas WHO Technical Advisory Group on Virus has standardized this technical nomenclature to easy to pronounce and non-stigmatizing labels for VOI and VOC for public discussion. So that is what we get it in the Greek alphabet, like alpha, beta, gamma, gamma, delta, and which now Omicron. Everything has been given a simplified name. So these are the labels actually. If anything is labeled as alpha, beta, gamma, delta, it has a lineage in the as per the other nomenclature classification. So currently we see the delta variant is a fourth variety, which is in the Pango lineage is a B1.61.17.2, which has a GK. Its prevalent was in India and the variant of interest was detected in 4th April 2021. And we became a carrier areas of concern in 11th May 2021, which caused the second wave in India. So now we have the Omicron, which is became under VOC in 26 November 2020. Sorry, that's 21. So what is a variant of interest? Variant of interest, it has a mutation that are suspected or known to cause significant changes and is circulating widely. These variant of interest are continuously monitored in case they become a variant of concern, which is the next step it goes. So variant of concern is known to spread more easily, causes more severe disease and escapes the body immune response. Change clinical presentation as the presentation symptoms may differ or decrease effectiveness of known tools such as any public health measures, diagnostic, treatment, and vaccines. So variant under monitoring. A SARS-CoV variant with genetic changes that are suspected to affect various characteristics and with some indication that it may pose a future risk. But evidence of phenotypic epidemiology impact is currently unclear, requiring enhanced monitoring and repeat assessment pending new evidence. So they are under constant monitoring. So who labels will not be assigned like Delta or Omicron, but it be observed. Former VOS CBC will be monitored for extended period under this category. So variant of high consequences, VOCs may demonstrate some of the attributes of a VOC, but have more evidence that prevention measures or medical countermeasures have significantly reduced effectiveness. So including the vaccines may not be effective in this. So far, no variant has been termed as a variant of high consequences. So these are the variants we talked about. But Tamil Nadu, so far, right from COVID started in 2020, there are about 31 lakh cases. People have been affected, and 29 lakhs have been recovered, and only 37,264 have died since as of January 24th, January 2020, and we have around currently 2,60,000 active cases. From January 2022, new positive cases have shown an increasing trend. So this is the latest thing. So we have around 5 crore, 6 crores around test has been done. Test positivity rate has been 5.2%. Reported cases have been around 3,13,000, 3.4 have been. For the last 24 hours, we have an increased trend of 20.4%. That's the biggest jump that we are seeing. Likely, we are currently reporting around more than 30,000 cases. So COVID status, what we saw from all the three waves is we have for 2020, we had confirmed cases of, that's the first wave that was 7,27,000 cases. In the second wave, we had around 19 lakh cases. The third wave, within a short period of 1 month, we have around 3,85,000 cases. Though recoveries have been the most effective in all the this thing. 19 lakhs are recovered in the second phase. The deaths have reported also have increased trend now within the last 1 month, though its total average cases is high. The death rate is very less, but still 442 for this month. That is from January, it has been reported for the third wave. Gender-wise distribution is mostly male predominant in all the waves. Age-wise distribution, we can see that it's again the 13 to adolescent to 60 years age group. We have the highest cases in all the three waves. In district-wise, so most of the cases are in the blue line with 20,000 cases, with Chennai reporting in red more than 6 lakh cases, confirmed cases. Death again, Chennai shown increasing with Coimbatore coming under also showing around yellow cases. So this most of the affected districts: Chennai, Chengalpet, Tiruvallur. For the past 7 days, we have a case recovering spiking everywhere. With 2,000 incidents of new positive cases increased from 2,000 since 4th January to 24,000 cases on 14th January. Now it has cost around 30,000. Test positivity rate is almost 1% and increased to 5% as of 16th January. Again, daily growth rate also shown increasing trend from 3rd, 7th, 4th January. Test positivity rate has doubled to 20% to 1% per average. So this is the for week-to-week comparison. We had for last week 10 to 16, we had around 1,63,000 cases with confirmed cases. Now it has moved to 1,94,000. So Tamil Nadu total recovered cases were reported 92% and 5.2% total positivity rate and 1.2 were reported deaths as of January 23. So there's an increase in the growth, the trend only is reporting. So vaccination status, this report, thanks to my colleague Dr. Pooja, who's also in this thing. She has closely looking after the COVID vaccination in Tamil Nadu. So this is India status that we have crossed more than 1 billion cases doses as of Tamil Nadu. So we have first dose we have achieved more than 70-80%, but the second dose still we are we are pushing forward, and we have also started with the 15 to 18 is school immunization also. Then from 10th we have started the precautionary dose for the elderly above 60 and comorbid and healthcare workers. So total dose administered at home, we have around 1987 vaccination centers is 8.73 lakhs, of which first dose is 58% and second dose is 41%. Precautionary dose we have started now is around 1,70,000. 88% of eligible population have received one dose. 62% of eligible population have received both the doses. They are fully vaccinated. Rate of vaccination is 3.5 lakh doses per day, with still first dose being 1.7 lakh dose and second dose 1.5. This is district wise with completely immunized percentage with 69%, Chennai, then Kammi, Coimbatore, Kammi 75, Tirupur. With Nilgiris has achieved 82%. So every district has achieved around more than 50%, except Dharmaburi, which is falling at 47%. So these are the issues with the vaccine coverage. Initial scarcity we had with the vaccine. Then still we have hesitancy regarding overall vaccine effectiveness and effectiveness against recent virus variants. Then fear of adverse effects among beneficiaries. Inward-outward migration of beneficiaries from coverage area. Outside field health staff, vehicles engaged in containment and treatment activities. Active infection pushing forward utilization of vaccine on due date and creation of new containment zones. I think I've finished, sir.
Thank you, Doctor. Some of the figures you mentioned are quite startling. I think the rates are still up. If you're looking week by week, in Tamil Nadu at least, I'm sure it's similar for other states as well. I think Kerala is pretty bad, as we know. I read in the paper today that Coimbatore is also, I think, positive rate is far higher than Chennai. Okay, thank you, Doctor. We'll get back to you. I'm sure there will be some questions based on this. In a broader perspective. But we'll come back to you. Let's hear Kaushik Ganguly speak about breaking the chain of transmission. Kaushik.
Shashi, let me share my screen. So my presentation is more about rather than breaking the chain, to look at it more holistically in terms of preparing for any what we need to consider holistically to prepare for any further waves of the pandemic and how we move forward in this kind of a scenario. So to begin with, I will just give you a brief glimpse of the national picture with the 5 states that are reporting that have the highest number of confirmed cases. Most of you are in might be already be closely following this. So, like Shashi said, that there is a downward trend nationally observed in terms of confirmed cases and active cases, but what we need to understand is that different states are at a different level. I know for a fact that states like West Bengal, 2 weeks back, was reporting very large number of cases. Perhaps was the first or the second state second worst performing state in terms of total number of confirmed daily detected cases after Maharashtra. But over the last 2 weeks, we are increasingly seeing southern states like Kerala, Tamil Nadu, Karnataka increasingly reporting higher number of cases. In fact, Kerala's test positivity rate yesterday was close to 40%, which means which is very, very high. Kerala, even during the second wave, had reported higher positivity rate because they have always adopted a targeted approach towards testing. Their average test positivity rate were already higher than the national average because of the approach they follow. But with Omicron, in the current phase that we are seeing, the test positivity rate has just shot through the ceiling, which is for the last week, I think it was around close to 40%, like Sashi was mentioning. In Tamil Nadu also, the average test positivity rate over the last month or so I think has been hovering around 19%, which, as Arul was mentioning, may have shot up slightly more than that. And as Sashi mentioned, Coimbatore may be reporting more number of cases, more test positivity rate than Chennai. What is interesting in this diagnostic is that although we are so we need to understand this, that the disease progression has its own timeline, and the timeline was different in the case of Delta. The timeline is slightly different in the case of Omicron. In Omicron, we are seeing people recovering from the disease much faster, and many states have issued guidelines in terms of lower isolation days, lesser number of isolation days in some states. But you may also see as the pandemic progresses, you may over the period of time you may see bed occupancy rates in hospitals going higher, death rate going higher, because as we move closer to the peak and beyond it, these are the indicators that usually follow with a lag. So as common citizens, journalists or laypersons, we at times may get worried because of that these indicators are spiking, but these are lag indicators that will follow the detection of confirmed and active cases, basically. So in this slide also you will see that although the other numbers are dipping, there's a slight dipping and plateauing of the numbers. In terms of deceased, the numbers is on an upward trend. So we should keep that in mind, how the disease progression and how the capturing of the number works, basically. With that in mind, if you see that the highest number of cases, and how we are going to prepare in terms of our preparedness for the disease, we also see that India is doing a substantial amount of genome sequencing, out of which most number of genome sequencing is happening perhaps in Maharashtra and Kerala, which 2 states have taken up their own state level approaches for genome sequencing based on laboratories available there. Apart from INSACOG, which is the national consortium of 38 laboratories across the country that is doing genome sequencing. And you can see from the graph on the left hand side that with over the map of India, it's Maharashtra which has the highest number of genome sequencing. Close to 27,000 samples have been sequenced, followed by Kerala, Delhi. Most of the other states which are on the upward curve of the pandemic at this point in time may not be undertaking genome sequencing to the extent that that might be required for proper to design a proper predictability of the disease progression in the coming days, basically. So, in terms of framing of the issues with respect to how we prepare for the COVID world and the upcoming wave, and how we, like Shashi framed it as breaking the chain, we need to frame a number of things that, number of issues in the correct light. So, are we able to predict the progression of the disease with certain amount of accuracy? There are a number of epidemiological models that have tried to do so and are doing it. Post facto, some of these models have proven to be closer to reality, but none of them are accurate. And there are a number of factors that that contribute to that unpredictable nature of this public health calamity. And this is because how policy handles are shifted, how managing the pandemic. To what extent are we imposing a lockdown? To what extent are we as people behaving within the community? Pace of vaccination are important aspects. How, in terms of to what extent are we opening up our economy, which also determines how what is the speed of travel between of people from one part of the country to another, or from one part of the world to another. That also determines the speed at which the disease progresses, and this is something that that are often decided on the spot, contextually, and cannot be predicted by a model. So, so models can never give us an accurate picture of what is going to happen. And in that context, we need to always have our ears on the ground in terms of what is happening. And that is where I will go back to my last slide in terms of what are the variants that are emerging. Is something that within the population is something that we need to keep a close watch on. Is something that we need to consider, and also scaling up of vaccination rate. The more we vaccinate, the more we trim down the possibility of variants, as we basically trim down the possibility of new infection. So these are important aspects that we should consider while predicting COVID-19. And the challenge is that the spread of the disease is not determined by a national policy. We cannot basically label one policy as having an effect on the disease epidemic progression, because even if a particular country, like suppose India, achieved 100% vaccination rate, with Omicron, like we see, it was first detected in Africa, which is largely under-vaccinated, if not unvaccinated continent. So there would be pools of infections where newer variants may arrive. With a globalized, interconnected world, these vaccines could travel to other countries, even where countries which have achieved higher level of vaccination, higher saturation of vaccination, like we are seeing in parts of Europe. So it's not one policy, policy of one government that can be held accountable to this kind of. It's a global phenomenon, and it has to be a globally coordinated policy action that would matter most in the pandemic situation. So in terms of also preparedness for our oncoming wave, we need to see how health system strengthening that has taken place. We saw during the second wave how it exposed our gaps in the health system, and how at a later part a lot of corrective actions have been taken in terms of oxygen plants, in terms of in the installation of oxygen plants and improving oxygen generation capacity, in terms of deploying of equipment like oxygen concentrators, high flow nasal cannula, in setting up of pediatric ICU. It's almost like many places actually, before many states before the second wave did not have pediatric ICU. It's almost like a novel concept that has emerged after the second wave, and a lot of states, a lot of health systems are preparing pediatric ICUs for taking care of the children in, say, 0 to 14 age group who might be seriously affected with the pandemic. So a lot of investment already is taking place, but what we need to be mindful that human resource, a trained human resource in health is a gap that requires bridging in the long run. It is not something that you can mobilize in a short run very easily. There is a need for strategic investments in certain areas. In terms of policy preparedness, once again, we need to have guidelines, trainings, and other things there, and SOPs in place for treating and dealing with the pandemic, which are coming into the system, into the health facility. So that this includes surge capacity. If there is a sudden spike in the number of cases, the health system should be adequately equipped to address that surge with the training, human resource deployment, equipment deployment, and infrastructure, which means that the system has to have a certain amount of redundancy in place to take up this surge. And currently, our health system is not perhaps equipped with such redundancies in place, so that to bridge those surges. And in this context, we also need to see procurement and supply functions in health, which before now we have not bothered much. We always thought health was about having a hospital, having a doctor, and having certain beds and certain equipments and medicines in place to be able to treat a patient. But imagine what amount of logistical functions have to be put in place to have a functioning, even a primary healthcare facility, even a facility which primary healthcare which has, say, a 5-bedded facility, to be able to have asepsis protocols in inpatient ward, or to have a laundry system that will even a simplest thing like a bed sheet in an inpatient ward, which needs to be removed, cleaned, and observing all asepsis protocols, and then again deployed into the ward over which the patient will basically have a comfortable care. So that the simplest thing has to be thought through in such a pandemic situation, and solid protocols and frameworks has to be put in place, not just for medicines, not just for having human resources, not just for having equipment, but for the most simplest thing like disinfectants, like adequate linens, adequate water sanitation equipments, even for a broomstick to clean a COVID ward regularly. So all these logistical function and supply functions has to be put in place, and then over on top of that, you need community level preparedness. So as a citizen, as a community member, I need to also know and understand what do I do when I am infected by COVID-19 or somebody within my family I understand are showing symptoms of COVID-19? Most of our community members are not yet well aware. Even if they are aware, they are afraid of appropriate reporting and taking appropriate steps. And in many cases, many of the deaths that we are seeing in this pandemic is because perhaps in many cases there are delays in reporting the case and seeking adequate timely medical attention as well. So with the timely response at the community level, also a lot of at hospital admission, a lot of deaths can be prevented. Last but not the least point in this actually is the health financing option, where we know as in India we spent before the pandemic nationally we spent around 0.9 to 1% of GDP in health, which perhaps has moved to somewhere between 1 to 1.4% of GDP with the pandemic now. So if we compare it to comparable countries with India, we are not going to compare with UK, US, even comparable countries with India like Sri Lanka, Brazil, Mexico. These countries spend much more as percentage of the GDP on public health. And we need to find resources, fiscal space, even though we are facing an economic downturn where our government resources are constrained, we still need to find ways how we improve our health financing approaches and health efficiency with which this money is spent, so that all the appropriate steps that I just mentioned before can be taken. The third and most debated point that we had seen during the pandemic and after the second wave was that whether third wave is going to affect children more than adults, and I believe that those discussions and debates have been put to rest now. With as in this current pandemic, also we are seeing that small children particularly, are one of the least affected population, and that's what also Dr. Arul's slide, the age group wise slide, was showing that it's one of the lowest rate of infection in 0 to 12 age group. But what we need to be mindful is that there would be indirect impacts on children, like Shashi was saying, and COVID, just recovering 2 weeks from the COVID is not always a recovery. We are seeing in both adults and children some certain prolonged impact of the disease, and that's where our health system needs to come in, response needs to come in place, where it's also able to detect post-COVID syndromes or inflammatory syndromes in both adults and children, to be able to take care of this in due time. So I will move to with this framing of the issue. There are a couple of things that we need to understand in terms of preparing for a COVID endemic world. Like I said, as the part of the health system strengthening, we need to have a holistic focus on, say, universal health for all populations, looking at non-communicable diseases. RMNCH, we know non-communicable disease, importance of non-communicable diseases needs to be underlined, because in many cases, at least in the adult population and 60 plus population with comorbid conditions, we are seeing people with comorbid conditions like hypertension, diabetes, and COPD being one of the worst affected in the COVID-19 pandemic. And in certain cases where we are seeing where people have these under control are faring much better than those who do not have these under control. So we need population level surveillance on non-communicable diseases also to be able to address these issues. And Tamil Nadu in this context has taken some certain very important steps. At least in urban areas, they have Tamil Nadu government has started NCT surveillance and screening at the population level. Similarly, in terms of maternal and child health, we know that the COVID-19 pandemic does not in pregnant mothers. There is no evidence that says that fetus can get infected from an infected mother, but the infection can adversely affect the pregnancy in many ways. So strengthening and early detection of COVID-19 in pregnant mothers, and as well as giving special attention to pregnant mothers, particularly in the third trimester, in which they are maybe more prone to COVID-19 infections, and with COVID-19 infection may see adverse outcomes of their pregnancy in many ways. It needs to be highlighted. Thirdly, in terms of infectious disease, other infectious disease, COVID-19, we are too worried about COVID-19 for our own good at this point in time. We during at the fag end of the second wave, we also saw Kerala witnessing Zika virus outbreaks in small pockets, which they could contain because they had prior knowledge. During the second wave, we also saw outbreaks of mucormycosis across the states. So we need to understand, and there's a real. We need to understand that there is a real threat of other opportunistic infections taking place under the garb of COVID-19. So we need a very strong infectious disease surveillance and treatment protocols, particularly for the infectious diseases that are very common in Indian context. There are several ones, TB being one of the most important. So we need to take precautions for this kind of infectious disease also. And we need to understand that COVID-19 is not just a random, because a lot of people are saying, and there are global evidence also that as our weather patterns change, as our climate change, there is a real threat of new variants of zoonotic diseases spreading within human populations as due to lack of due to human-animal conflicts where viruses may jump from animals to humans. So so we need to prepare for a world where prepare for a COVID endemic world, and to move on with our other systematic health system responses, along with preparing for the other infectious disease outbreaks. And this is where once again infrastructure equipment gaps come in for investments in these areas, as well as long-term investment in capacity creation for human resources. So for a country like India, our just doctors to ratio and doctor to patient ratio and nurse to patient ratio is very, very less compared to WHO norms. It's almost abysmal. So we need really, really long-term investments in human resource capacity and R&D, research and development. We also need to understand our behavior change communication practices in the current context. As of now, in the COVID-19 pandemic, I will give you a small example. We have always advocated wearing masks for protecting oneself, but we need to shift from that paradigm to advocate for people to wear masks to protect their not just themselves, but their near and dear ones and their community. The community level ownership on very simple tools like wearing a mask needs to be there. And this is where behavior change communication, role of media, social media, and positive messaging needs to be emphasized in this current context. And this is also where how the situations we create in terms of our response to the pandemic has a telling effect also on mental health and psychosocial support needs of the population. And we know that during the lockdown, even during last year, a lot of we in our personal lives and within our family are also seeing our family members going through anxieties, depressions, children not missing out on schools and their lessons are anxious about what their future is going to hold, how they are going to fare in exams. Simple, and this is where a strong mental health and psychosocial support, which as on date has not been a mainstream part of our health system responses, gradually have to become part of our mainstream responses. If we, even within our public health system, if we go to a public health facility, we will hardly see a place where somebody can access counseling for different any challenges or that the psychosocial support needs that the person may be having. But these are something that needs to be mainstreamed as part of our health system response, both in the public and private sector. And the role of private sector, I will come to as a separate slide. I will just.
Kaushik, are you done?
I will just
because the panelists are waiting. Yeah, you can come back to this a little later.
Sure.
Yeah.
Okay. I will stop
All right.
here.
Yeah. Thank you.
Thank you.
All right. So Kaushik has touched a whole range of issues. I know you're all waiting, so just don't want to go along with his presentation for a while. We can get back to it if you have time. Our focus is on children really and on mental health and the impact the pandemic has had on children. We've heard what Dr. Anand has spoken about the vaccination drives, etc. And he mentioned, vaccine hesitancy. And Kaushik has touched some very important points. Is there a sound in the background? If someone has, I think someone can mute. Am I being heard clearly? Yes. As Kaushik was mentioning, it's not about having a national policy to tackle, pandemics. We also need, people to understand what has to be done, what can be done right, and what shouldn't be done. There has to be proper infrastructure. Frontline workers, doctors, and others have to be properly trained. So there are a whole range of issues. I'll start with you, Sudha. If you're there, you've heard both the speakers. Maybe you can, take off from what they said and also, bring in some of your own perspective, focus being on children and the impact COVID has had. Sudha.
Yeah, thank you, Sashi. First of all, the education of children has been severely impacted. I think some of the smaller children have forgotten what they learned in school up until COVID struck. Even with online classes, there was a lot of adjustment that needed to be made to get used to it. You had children lying on the floor and trying to listen to the teacher, the parents playing a very active role and popping in every now and then. So there's still, a lot of adjustments. And these are not just children who go to elitist schools. If you look at the lower end of the spectrum, there was this huge digital divide, one cell phone going around, the family. So that connectivity issues, all this made it very difficult. I think schools need to adapt much, much faster and reorient themselves to this new situation. And for instance, I saw the work of an NGO called Aid India, and they did wonderful work in terms of developing offline modules for children. They didn't always have to be online. They took care of families with provisions and all that, and also the education of children. So there were offline modules, some online lessons. So it was a happy mix. I think we need more innovative measures to, it's not difficult. And I think we've not adapted fast enough because this has been going on for the last 2 years. And of course, schools complain that they are constrained because they suddenly can't increase the space or numbers of teachers at a whim. So they have their own constraints. So maybe we should go back to classes under the trees, well ventilated rooms, and offline modules, and reorient this whole system of education. Two other things I want to say is that the family unit has really been rocked quite a bit, because it's too close for comfort. Everybody is cooped up at home. We're trying not to get into each other's hair, and there's income has been severely impacted, and domestic violence. Children have suffered because sometimes they've lost near and dear ones. They don't know how to cope with it. There's fear. There's a general sense of fear. We even finding it difficult to sleep. So I think it's impacted the family unit as well in many ways. I just want to quickly touch on two other things. Sugato Roy talked about, things like having to replace bed linen or even a broom. I think we have to not lose sight of the fact of what COVID can do to the environment. How are we disposing our masks, our PPE, our, whatever disposables, etc. I think we're sitting on a time bomb in that regard. We have to devise measures before it's too late to dispose all of these things very sensibly and in an environment-friendly way. And also a greater awareness, community health consciousness, and stress on health and hygiene. We can make children the ambassadors because they're quick to absorb all these messages. I think cleaner communities, safe drinking water, no stagnant, sewage here and there. All these things are very, very important in the fight against disease. I think we've done remarkably well in a very, very short time, but we need this preventive health mindset has to be ingrained far more deeply in our psyche. And I think then that will take care of a lot of things, simple things like breathing techniques, yoga, exercise, physical exercise. All of this will help, the right foods. All of this will help in building up our immunity, because ultimately that is a key factor. So I think these are my points.
Yeah. Okay, Sudha. I think Lasya has joined. I can see her. Lasya, but I don't can see your name, but are you there, Lasya? Sugato, can you include her as a panelist? I think she's joined, but I can't see her here on the screen. All right. Padma, you're there?
Yes, I'm here.
Yeah. I read a report today in today's newspaper that there are, children. I forget the name of the place, but it's very near Salem. And you've done a lot of work in rural Tamil Nadu. There are children who have to trek 15 kilometers to attend online classes. So this is the state of affairs. And how do you see it, actually happening on the ground? Because you've been to several of these schools.
Yes, thank you, Sashi. I mean, I think a lot of these points have been touched upon by people who spoke before me. But what we have been observing is more in, as you rightly said, the rural setting, in settings where children are going to government schools. There, I think overall, even the uncertainty and anxiety among children, because schools are suddenly opening, they have not had these online classes. They've only had activity sheets that they go in once a week or in 15 days when they collect their eggs and they collect their little nutritional supplements from school to hand them over. But other than that, they have not had regular classes like the private school children. So then school reopens, they go to school, then they suddenly after a week again schools closed. You saw that schools opened, then there were rains, again schools closed, then there was uncertainty as to when exams were going to happen. Again school reopened, then there was Pongal holidays, again schools were supposed to reopen, but now we have the Omicron wave. So children are totally confused as to what type of exams are going to happen, whether it's going to be online, offline, what classes are going to happen, particularly children who are in the 10th and 12th standard, because for them every one has been saying they have to definitely do their exams. So a lot of uncertainty because last 2 years. So ideally, if someone was in 8th standard, suddenly they find themselves in 10th standard without any lessons having happened over the last 2 years. So the amount of stress and tension for them to be able to do well in the school final exams when they have had absolutely no learning in the last 2 years is enormous. And in schools, again, when they are school final children, the pressure is so much on the teachers and on the students, because in government schools with the social distancing and very limited facilities, suddenly the schools are looking at things that they've never looked before. And that is the area that we are working closely with them, like hand wash units, contactless hand wash machines, and temperature checking every day. Only 20 children in a classroom, and they might only have 4 classrooms, which means that number of hours in schools is limited. Children have not seen their friends in the last 2 years, so they are all over each other, ensuring that they are maintaining social distancing, ensuring the teachers are not infecting the children. The scenario in government schools is so much more difficult, both for the children and for the students. And the parents who are all wage earners definitely want children to be in a safe place where they are getting nutrition, because another big gap that was there for the last 2 years was most children whose parents were daily wage earners or support staff were getting all their daily nutrition only from school, which stopped all of a sudden, because of which what happened was, if the child was over 14 years, the parents sent them off to work in a shop, or to work with them in the agricultural field, or they had additional cattle or livestock to take care of. So the child more or less went out of the school system, and because schools were not happening, they just brought the children one day to collect the books, and after that no learning has happened. Practically the child is out of school. And in tribal and rural areas, you even found that girls were married off because they could not afford to keep one additional child fed at home. And we are now building a labor ward in a primary health center near Uttarameru, where we found out of 22 girls who have delivered this week, there are 3 teenage pregnancies, which obviously means that girls are also getting married off, whether they are just completed 18 or even below 18, we don't know, but silently that is also happening. And so when they are not physically, mentally, emotionally prepared, children are either being sent out to work or got married because of the family settings. Again, no training. Earlier the girls used to get their sanitary pads from school, and if a child attained menarche in school, then the teacher would do a little bit of counseling, tell them what it is about, talk them through myths. Something was happening. Over the last 2 years, that has totally stopped, because the free supply of sanitary napkins has completely stopped, whereby even the mothers, because of lack of funds in the family, have gone back to using traditional methods like using cloth, and the children have also gone back to that, because of which there are a lot of these bacterial and fungal infections that children are going through. The other most difficult thing for the children has been that many children who are studying in private schools have now been moved to government schools. The government had a policy that if the parent is not able to pay the fees, because in many cases the parents had to pay, and then as Sudha was mentioning, the children had to undergo online classes with just one mobile phone that the father will take away with him to work. So in many lower and middle income households, the children were moved to government schools. So that complete culture shock for the children, that they lost in touch with all their friends. They had to go and be in infrastructure that they are not accustomed to, use toilets that are really pathetic and not something that they are used to in the past. So that has again put a lot of anxiety in children. And of course, domestic violence, which Sudha touched upon, that has been a big problem. Added to that was sexual abuse. Many cases where girls have come back and reported of abuse by relatives, abuse by neighbors, even fathers, when everybody was in lockdown and at home. So you can see that overall, and even in school now, there's no physical education. So they go to school, but there are no PT classes. So physical activity is less. Their eye strain and headaches have increased because of the digital learning. And overall, the children are completely confused. They are very unsure. Their confidence levels in general are low, and they are not developing social skills, because over the last 2 years they have almost stopped socializing with either their peer groups or with people in the neighborhood. So I think this is all I can talk about as effects of the loss.
That's quite that's quite a great picture, especially the the fact you mentioned about young girls getting married, and it's quite startling, really. Lasya Shekhar is here. She works for News Laundry, bright young journalist who's done a lot of writing on social and civic issues for Citizen Matters for many years, and earlier with Deccan Chronicle. Lasya, good to have you. I know you've done some work on the ground during COVID. You've heard what Padma was speaking about. Basically, she was speaking about the level of stress being far higher in marginalized or vulnerable families, and of course for children. I must also add, who are living in childcare institutions, for example, and also children you find on the streets. And there is also the aspect of children with disabilities. I think you've done some stories relating to this. What has been your experience on the ground, reporting during COVID about these children?
Thank you, sir, for having me. It's really a privilege to be a guest. It's a learning experience for me too, and I'm guessing I would find some story ideas from this conversation. So actually, when I saw my brother attending classes, and when I asked him, like, do you have? He has like just joined college and he was attending classes. He didn't even know the student's name. There was no interaction as such. But that is not at all an issue. Like when you compare the plights of the marginalized or the children with disabilities. So for children with hearing disabilities, that is, a virtual education is second to, it is something that has no, there is no impact on them. But imagine a child has a hearing disability and poor. So that is something I've worked. Like when I was doing an article for Citizen Matters, so there was a child who was doing really good in class despite his hearing disability, because that is a model he was accustomed to. He knew how to, he could understand the sign language, and there was a way his parents would help him. There was a lot of such things. But when the when education became virtual, he had to skip school for there was no classes. So there was classes, but he couldn't afford a smartphone. His father had to actually do overtime for 3 months to afford a smartphone. But his plight did not end there. He could not understand. The virtual education, even if the teacher was teaching through sign language, that was he could not cope up with it. So that was one problem. And there are a lot of solutions. There are the state government also, the education department is actually telecasting classes for such children. But it's not, there are flaws too in that method, because they would be very late, the subjects are not very clear, there's so many such lapses. And there was another story I've done with how do students with cerebral palsy deal with the whole situation? They need maintenance therapy. They have to be in these special schools, and they have to be among these children to feel confident. How do their parents cope up? So interestingly, parents actually came up with impromptu solutions. In a case of a girl who needs maintenance therapy, her hands had to be stretched regularly for easy movement. That could not happen because they had to be confined to their homes, the school. This was all done in the schooling program, but that was not happening. So what the mother did was she used to stretch the hand of the girl, not for exercise, but to apply mehendi, it became part of the work. She would ask the girl to apply kumkumam to the idols at home. She would ask her to do whatever, peel off the skin of potato, whatever she could. So that acted as therapy. So this is actually a clear, this is a happy story of how parents are being empowered. Parents are coming up with solutions to keep if not better the situation, but to maintain the existing situation. But despite all this, one cannot ignore the fact that this pandemic is being very harsh on children, especially those with those belonging to marginalized groups and those with disabilities. So yeah, there's so many such examples.
Yeah. Okay. Thanks, Lasya. I'll move on to Ragini now. And Ragini, you've been listening to what has been said so far. And, one of the very important issues that has been raised here is also how children, feel confused often, especially the younger ones, there is frustration, anxiety, etc. And also the aspect you must consider that a lot of these adolescents are now exposed like we were never in our lifetimes to social media, and that opens up a whole huge can of worms because they might not even know how to handle some of the information they find there. Also, I feel some adults may, be finding it difficult to communicate with children about the situation and how children can cope. And that also puts an additional burden on children. What has been your experience in dealing, with children? I'm sure you must be finding yourself more busy the last couple of years because there might be more cases, I'm sure. Ragini?
Yes. Thank you so much, Sashi. Am I audible?
Yes, yes.
Yeah, great. So thank you so much for inviting me. It's really honor to be amongst such lovely people here. So last 2 years, as you're saying, from 2020, yes, the number of cases, the appointment, everything has really gone up. And if I say the commercially, probably I should say good, but it's bad. We feel sad that the cases and the numbers are rising so much. And we are trying to do as much as possible but ultimately, unfortunately, mental health professionals are much less in India than what is required. But we are trying to deal as much as possible and as efficiently as possible things. So when we talk about effects of COVID in children, actually there are different age groups. So when you say about the young kids, like who are just say 3 years primary kids, basically to primary kids. So imagine the plight of children who are first time attending school, who are just getting admission in school. They've never been to school. For them, the school is screen. And that's not the school is meant to be. And that's not what the school experience is. And they're confused because what parents actually, these days, parents are quite aware and they are quite active parents, and they just try to tell children that when you go to school, you'll have playground, you'll meet people, some schools have snacks, you will be carrying snacks and, opening the snack with others and eating it. And they're not doing any of those things. So that they're confused that is this school? Because parents all the time, right from the child is like slightly maybe 3 months or 4 months, 1 year, parents try to actually control their screen time. And now parents are asking them to sit in front of screens. So that's such a confusing thing right from the beginning, basically, that you are saying that screen time is limited. And now because schools are online, their other entertainment screen timing is getting reduced. So that's even more frustrating for the younger kids, especially. Then when you come to the adolescent, like, maybe 10 years onwards, 9-10 years onwards, connectivity connections are the so important part of their upbringing of their development, and they're losing out on their connection. They say that yes, we are chatting or we are doing online, but there's nothing like, sitting together and making fun of something. Or, like I know that there have been a lot of these jokes that, people are making fun of PT master or somebody else, but that is part of their growing up. That's part of their development. It's part of their life, that enjoyment, and they're just missing out on that, basically. Then that comes the little more older people, like 10th standard, 12th standard kids. The most important thing they are facing is the uncertainty. They don't know, because every time, I think, like right from the time children are born, it's like 10th and 12th standards are like the biggest monsters in their life. 10th standard is the most important thing. You must do well so that you will get whatever you want to do. And 12th standard is like do or die situation. You have to do it, otherwise you are doomed completely. Okay. And So children are so confused because they're so uncertain. They don't know what is going to happen. Suddenly CBSE said that no examination and everything is in teacher's hand. Now, when it's in teacher's hand, there is a lot of biases also. I know our teachers are doing whatever best they can, but ultimately it is not about just what has happened. It's so many more things involved, and children will never be happy because they will think that no, so and so person didn't like me and that's why I got the less mark. I know it is not right, I know it is not fair, but unfortunately that was comes to children's mind. So there is so much confusion. And actually, frankly speaking, if you see children sitting at home, if it is a holiday, like when you say, somebody said about rain holiday, they're happy, oh yay, it's a holiday. But that is the option. Now it is being forced on that. So they are so confused about that, basically. My prior speakers, they mentioned about one device. So there are so many people who have just one device, one laptop or one mobile phone. And as like parents, they say they need it because they need to earn. Children, they need it because they need to study. And the most important thing, forget about even that, the most important thing is that whether it is parents, children, and especially children, everything has reached their home. The school has reached their home. And what they are finding it difficult is when the communication is happening, when the conversation is happening. Oh, so your room is so small, or or do you have a dog? Oh, I don't have a dog. Like to the richer people, to the little less privileged people, saying that, oh, I see your mother cooking behind, or I see so and so cleaning behind. So children are ashamed of these things, like they're so much exposed, not just education. So many people have spoken about, so I'm not even going there because it's being discussed about, and I know that's something which will always be discussed, but I'm talking about the socio-psychological part of it. One of the most important part of survival is authenticity and connection, and connections are not happening. But in the process of trying to make connections, children are losing authenticity, and that is what is basically affecting them so much, so much. And just one more thing, because I'm very fortunate, I've been associated with multiple schools also. So in the short time when the schools were open, and I observed that when I went to the class is pin drop silent. I mean, that's teacher's ideal class, that, class is quiet. But for us, for mental health professionals, for counselors, for the people who want to work with children, with them like as they are, like, and not as what we expect them to be, they are quiet because they have lost what the social connection is. They have lost how to voice their voice out. They have lost to express them. They are confused. They don't know how to connect with each other. And I think the most important part here is basically children are indirectly subjected to two anxious people, which are the most important people in their life. One is parent and another is teacher. Parents are anxious because they have the survival, of course. So many people have lost their job. They don't know. They themselves have uncertainty. Again, as we said, that everything has come home. Their bosses are saying, why are you not attending the meeting? But the thing is, there is only one device. That is the time when child has to attend the school. People are understanding. It's not that they're not understanding, but frustration and anxiety is there amongst parents. Another thing is teachers suddenly have to adopt this online module, which they are not. Many schools, many teachers who are 45 plus and all, not tech savvy people, and I have directly spoken to the teachers, and they say that we have never ever worked so hard for our lesson plans in our life. We have been teaching for 20 years, 25 years, but we have never ever worked so hard for our lessons plan, because online they have to work double hard to reach out to children. So teachers are frustrated, teachers are anxious. So teachers' anxiety is passing on to children, parents' anxiety is passing on to children, and children don't know what to do with that. They're confused, they're anxious, they don't know what to do, and there's a lot of uncertainty. And I think all this can be handled if we provide them with a better infrastructure, with a better platform to open up, speak up, give them the chance to express themselves, what they are feeling. And I think a lot can be achieved, but right now things are really
Thanks,
that.
Ragini. Yeah, I know. We wish we could offer that platform, but with the virus still hanging around, it's not as easy as it looks. You touched about some important points about the social connect not being there at all, and also children looking at parents and others finding them anxious, and then that in turn getting back to them. Nandini, you've been listening to all this. I also see you trying to take some notes. You are the mother of a teenage girl. I'm sure she must be also feeling frustrated staying at home, not able to go to school, etc. What has been your experience? And you can also echo your views.
Okay. Philosophically speaking, Sashi, I think COVID is a wake-up call. A wake-up call to see what is not there in our system and to rework on it. And positive side of COVID, I was able to bond with my daughter more. Okay, I had more time with my daughter. So I think I will be the wrong person to even cite a bad example for COVID. But the thing is, it is worked in better ways for many. I think talking about academics, I think this is the time that we should start reworking on the syllabus, Now, probably the academics, the government should look at what is actually important for the child. I mean, right from class 1 to probably class 2 as well. And you see, this is what is important, rework the syllabus. So now we've been seeing this pandemic for the past 2 years, and you never know how long it's going to go on. I think it's high time we revisit the syllabus, take out all the things that is not important for a child, and make everything, all the academics, classes, subjects, all life-oriented, okay? Prepare them to meet life, just like what Ragini was telling, just like kids, first standard kids, they couldn't see school. There are many kids who just joined college and they couldn't, find that experience at all. They couldn't go meet friends, make new friends. All seems to be online. I think we just have to rework the syllabus, number one. Number two, as much as we speak about, everything online, offline, I think India is way ahead in online classes and courses. For example, we already have something called the NIOS. India was already prepared for all this, I guess. NIOS is a very good syllabus where it already caters to children who can study from home. So we already have that system in place. I guess all we have to do is fall back on that and see how that is done so effectively and bring it into the other boards. That comes to education. And I think as I was saying, it's a wake-up call to change personally, individually, family as a unit, and society as a whole. Instead of sitting and wondering about why everything went wrong. Yes, it's gone wrong. Yes, now what are we going to do about it, right? So I'm happy I have more time with my family. So probably a parent can even become a teacher and say, hey, I'm going to shelve my work for a while. I'm going to sit and teach you now. Okay, if I'm able to teach you. Or probably a neighbor can step in, or an aunt and uncle can step in. So I see this as ways for us to change in many ways and bring about, I think we can bring about some amazing changes. I'm sorry, I'm not able to add on the list of
woes.
Not just woes, but just because some really strong for me. What the students of the lower income go through emotionally and socially. So that's about I can offer to you. Right?
Yeah. Anyway, you offered the good side. I mean, I think it's all time for us to say to hell with the virus, and as long as we are socially responsible and behave responsibly, we'll carry on with our lives. Life has to go on in any case. Majra, sorry to keep you waiting.
No, it's okay.
Sorry to keep you waiting. I know Kolkata, you've heard some stories of Tamil Nadu and of course some of the cases in Chennai, etc. How does it, echo with you? You find similar situation there in Bengal, and what has been your experience in dealing with children there?
Okay, thank you, Shashi. To start with, I must say that there's nothing like Kolkata and Chennai now. Everything is online. So I am I know everything what's going on because of this virtual connection. But I can stick to the urban scenario in Kolkata, and I find little children referring to their school's name as online. Like I asked a little girl, which school you go to? She said online. So I think that's a huge kind of a a change, and we are going to, I think, see more online in the days to come. So we better get prepared for it. Another thing is that, what I see, I don't know about the rural side, but where I believe laptops and all have been distributed. So, I mean, it's high time that, a group of people get together to share that. But whatever PC given by the government, but in the staff and all, they are also having this very serious problems of sharing the cell phone, and they had to spend money to get a smartphone, from their the ordinary, phones to smartphone. And but I can speak also about the college scene, where I haven't been going to physical classes, but the students, I have been told, since they have just come direct from their 12th standard to first year, for a child's growth, that 1 year is also very important, when they face the challenge of the board exam and then come to college. So some of them are coming straight from that online home scenario to college, and they are being very juvenile. That maturity is lacking. You know what I mean? Like, you appear for your 12th and then you mature a little and then you get into the first year. What's happening?
Yes, we can hear you.
Yeah, okay. So, that I've been told that these students are very immature. I mean, first year students are a little immature, but they are being very juvenile, So they haven't faced that, board exam, the tension, and they've already got into college. Like, Anish says that, suddenly I find my son from class 8, I think somebody spoke about this, sitting, for his board exams. So, these are the common things. But to talk about, if you want to know about vaccines, I can give you some figures.
Yeah, you can just mention, because, we've got some figures from here. But how is the vaccine, vaccine drive for children especially? How is it going?
Yes, right. I've got the figures for children. But another thing I want to say about mental health, a lot of mental health issues in children are being reported where they're becoming violent. They are smashing things around the house and taking it out on their grandmothers because their mothers cannot spend time with them. They are working. But the positive side is also, a little girl said that, my father works and he also serves the food. So men are now helping around the house. So I think that, I'm not, forcefully bringing in the gender issue, but because the mother teaches, she has to be at a certain time and father has more flexible time. So she says father cooks, serves, and mother works. So, I think from childhood, if they see this, it's a good thing, So we must see all the manifestations of like a wake-up call, And so, children also are getting very violent, and they are saying that, they're becoming a bit more selfish and self-centered, because a little child was asked to draw something, and, we know Papa Bear, Mama Bear, Child Bear, but this one, she was drawing all animals as Papa Elephant, Mama Elephant, Baby Elephant, Papa Lion, baby, so her world is, just 3. So that is what other speakers said. They're not getting to go out and mix, which is one reason you go to school. So you can have homeschooling anyway. But why do we go to school? To learn some life's lessons, So that's
but how has the vaccine drive gone for children?
I just tell you. Vaccine, all this medical colleges and all were asked to give vaccines to people from 15 to 18. And it started on 3rd Jan for this year. So till now, 24th till January, about 39,887 in the 15 to 17 group.
Where in Bengal? In Bengal or in Kolkata?
In Bengal.
In Bengal. Okay, we'll ask the doctor how it compares with Tamil Nadu. Okay.
Yeah.
All right. Okay. Anything else, Manjira, quickly before I move to Susan?
And also, I think the day it was a holiday on 23rd January, you had more people. You had 15, you had 46,000. So on
All right, that's
holidays,
okay. It's only the figures, that data. That's all right.
Data, and I don't know how it's comparing with the rest of the population.
Yeah, so we'll get an idea from Dr. Arul later in a bit. Susan,
Okay.
I know
Thank
you've been
you.
waiting. Yeah, that's fine, Bajra. Susan, you've been waiting. Now, assuming you have to frame page 1 for a newspaper tomorrow after listening to everyone speak, how are you going to lay out the page?
Hi, everyone. Actually, whatever I wanted to say has already been said. I just want to say that maybe I highlight something which struck me from the books that I edited for UNICEF. There was a book that they brought out about children from underprivileged backgrounds. They are really street children. This was at the start of the COVID pandemic. And there was so much of hype about stay home, stay safe, washing hands, things like that. And this child, who is a street dweller, raised the question, how can I stay home when I don't have a home? And another child said that they were staying near the Egmore railway station. They were street dwellers too. And they had access to the water in the station. And that's where they collected water for their baths and whatever. But once the pandemic started, they were not allowed inside the station. And so water became not available. So then they were asking, how do we have a bath? And when they were chased off the pavements, and wherever they went, they were chased away. So that really struck me, and it kind of stuck in my mind. There's really not much point in saying stay home, stay safe to everybody. There are lots of people who don't have a home to stay safe. That's one thing. And secondly, on the positive side, I'd say that families, they have different situations. So I would say that this pandemic, like Nandini said, she bonded with her child a lot more. From child's perspective, I would say that they learned to understand the needs of others as well, because there has to be sharing. They have to make time for themselves and for their siblings and for their parents and things like that. And there were children who, as the pandemic waned, a lot of children with just younger parents, they were allowed to go out and play. But older or other families with elders in their house, they were not so willing to let the children go out and play. And initially that created a lot of friction. But the child learns that yes, we are responsible for the elders in the house as well. So I would say that there are two sides of the situation, both good and bad, and we just have to go with the good. So if I were asked to change the thing, I would highlight the good, because I think there's so much of negativity around. There's so much of distress. So maybe I'd highlight the good. That's it.
All right, Susan, good. So I think Susan, Nandini, and Manjira are in the same team. So that's good. So we have a lot of good stuff coming. All right. Anyone else would like to add anything before I go back to Dr. Anand and Kaushik? Doctor, are you there? Dr. Arul?
Yes, sir.
Yeah. Doctor, you must have listened to some of the discussions we've had.
Yes, sir.
Of course, you saw the Bengal figures. Just out of curiosity, how does it compare? I mean, how does Tamil Nadu and Bengal compare? That's one. But more importantly, I want to ask you a couple of questions. Either you or Kaushik can take. But one is, the general side effects of COVID have been found to be similar, by those faced by adults. And I think it's called adverse events following immunization or something, lasting a few days. What are some of the effects in children that are generally found, doctor? That is one. All right. I mean, the symptoms, I mean. The other question I had in mind, was some of the countries like the United States and Canada were the first countries really to vaccinate children. I think it happened in May last year. And in the United States, for example, they have, grouped children into two groups for vaccination. There's the 12 to 17 age group. And then there is, I think, the 5 to 11 age group. And they use smaller needles and all that is what I read. India has not allowed this kind of a vaccination scenario here. Any thoughts on that? I mean, these are my questions for you.
Yes, sir. Hello.
Yeah.
Oh. Sir, regarding the this thing, adverse events following immunization.
Yeah.
So most of the adverse events are less as reported so far. So mild, this we have a little bit of fever. Then this site only where the inoculated site has some burning sensation or like that only. But higher end so far nothing like we are not reported anything like related to COVID related to death. Vaccination related to death has not been established. So we have a AFA committee that's following it up. Only minor symptoms like fever, headache, or this has been reported. Otherwise, so far now, bigger events or symptoms have been so far related to COVID vaccination in children as well as in adults.
All right. And what about the age groups that are being vaccinated abroad? And here we have only the 15 plus. I think,
for age group, yeah. Pooja, can you share on this data?
No, just you can just
actually
mention. We don't want to, I don't think we have time for presentations anymore, but maybe you can just mention if there is any sort of logic to it or why India has not followed that route so far.
It's related to government policies, sir.
Okay, right.
Maybe still it will be in the trial stage. Trial stage.
Kaushik. Yeah, tell. Yeah, yes, Kaushik.
With respect to the second question, that the age group factor, the thing is that US have the vaccines available in India, that is Covishield and Covaxin. I think as per Indian government regulatory norms and trials, only Covaxin has been approved for adolescent age group vaccination as of yet. So that's why the approved out of the 2 or 3 approved vaccines, the government of India through its own due diligence approved only one vaccine for now in the 15 to 18, and that's why it has been we have started with that cohort based on government directions. US largely used a different set of vaccines for vaccinating children. So though I don't think that those vaccines are available or has been approved for use at this point in time in India.
All right. Now, suppose there's an unvaccinated child who goes out to play, in the playground or maybe later in school, unvaccinated. Right. Now, the child returns home. How risky is it for the people at home when you have an unvaccinated child going out and playing and mingling with other children?
See, the risk is as much as a person going to office or going to a market for shopping. The risk of a child getting the disease is as much as say from a 1 hour window period going to play outside to you or me going to the market to get our regular shopping would be similar. So both within the home as well as outside, following those COVID appropriate behavior norms, that's why very essential. The thing to note is that for children, we know clearly that for children the disease does not affect the children very seriously. The COVID disease itself may not affect the children very seriously, and the child may not require hospitalization, may require just normal health care as would a child require in case of an influenza. But the only thing that we need to be mindful is that in case of a children, after the child has recovered from COVID-19, there might be some long-term symptoms in the recovery period. So the cough and cold may linger on. The child may have certain inflammation markers present in the body, which may lead to some other problems. So those are the things that parents needs to watch out for when when we are letting child to go to school or even outside to play. Basically.
All right. Thank you. Anyone else has anything to say before I pass it on to Shugato? I think it's been a fairly good discussion we've had. Kaushik, sorry, I had to butt in. You didn't mention about the private sector, but if you can say it in a few words, you're welcome to.
No, it's the same. The private sector has to come in hand in hand along with our response to the pandemic as of now has been largely, we have been expecting government to do this and that. And largely, the response has been dependent on the system. And gradually, as we move to a world where the COVID-19 is endemic, we need also private sector participation in a major way under the regulatory framework, whichever is available. So those we can have perhaps a different discussion on that. So in the use of CSR funds, how CSR funds can be used, how research and development so that we have better predictive models can be used. These are the areas where private sector can definitely come in. So aware and pricing and messaging. These are the where private sector and industries can come in, broadly speaking.
Yeah, thanks Kaushik, and thanks Dr. Anand for also sparing time to make your presentations. Shugato, over to you.
Thank you, Sashi, for facilitating such a lovely discussion. Am I audible?
Yes.
Okay. I mean, you have given me a task of wrapping up the entire discussion. In fact, if you see with the start of the third wave, so-called third wave, or the emergence of this, what do you call this VOC, variant of concern, the Omicron started, a lot of dichotomy has been happening with the kind of messages that are going down into the field. When Omicron emerged, there was a letter from the Health Secretary, Mr. Rajesh Bhushan, mentioning Omicron to be the variant of concern to the all state government. So we have to pull up our socks, we have to be ready, we have to follow the COVID appropriate behavior. But vis-a-vis what we found our leaders saying, without taking the names of the obvious ones, they come on screen and say, ki, aap logon ko chinta karne ki zarurat nahi. You don't have to worry. This is not going to affect you. Oh God, all hell broke loose. Nobody is wearing a mask, moving around, and then we see there is a surge. So there is a clear, divide between what the policymakers are saying and what our elected representatives are saying, and that created a big harakiri. Then, if you see overall COVID and its impact on the children, starting with Sudha to Nandini, then everybody, all of you mentioned about how it has been affecting children. I thought of just summing it up into 4 or 5 categories, how it has severely affected children. First, taking the 5 categories on which UNICEF works on. The first one, the area of health. If I talk about the area of health, what happened? So much of focus on COVID management, the clinical aspect of COVID management led to drop in our routine immunization of children, led to drop in the pregnant mothers coming for their checkups. Everything started going down. And because most of our healthcare workers were into the COVID clinical management. So that's where we had a huge number of children missing out on their regular routine immunization. Now we have initiated the teens vaccination. What I'm saying, the 15 to 17 years and 364 days, children are going to be given the COVID vaccine. As Sashi, you are mentioning, and Kaushik mentioned, yes, initially when we got a training, the first round of training said that it is going to be a needleless vaccination for the children, and Zydus Cadila vaccine is to be used. But somehow something changed, and then the expert committee, the NTAGI, the National Technical Advisory Group, decided to go with Covaxin, and Covaxin is a vaccine which can only be given through needle, and that's how the 15 to 18 years group are being given the vaccines. But in this vaccination, we are tom-tomming about, okay, we have reached 1 crore, 2 crores, 3 crore children vaccinated, but we are still not trying to reach out to children in the hard to reach areas, children with disabilities, children out of school. It is very easy to reach out to the school. You organize a camp in the schools, all the school children will come and get vaccinated. What about the children who have dropped out of school? What about the children who belong to the particularly the vulnerable tribal groups, the most marginalized and backward communities? And that's a huge number. And we are missing out to them. So it is not a complete vaccination if you are looking at. And that is where the challenge lies. And I don't know how we are planning to reach out to those group of children. Then if you look into the nutrition, Anganwadis have been shut for almost 2 years. And Anganwadi is a place where we are talking about socializing of the children. The socializing stops. Children are unable to come. And that is where the major diet is given to the children to prevent malnutrition. That has been severely affected. The adolescent girls who get take-home ration, that is a ration given to prevent them from having anemia. That is also severely affected because take-home rations are being provided, but it's not the way how it should have been from the Anganwadi centers. Now, coming to the education, all of you have given brilliant points, and the point which Ragini was mentioning about where we see the group of, the digital divide, and we are talking about the children. One is the digital divide where we have children who do not have access to even one gadget. And I'm talking about the states, like I now have come to Orissa. I know where children do not have access to even a single Android phone. But Tamil Nadu is different, Kerala is different. But as Ragini was mentioning about, sometimes children do not want to put on that screen because of the kind of environment. They love to go to the school because at least to move out of that complexity. Sometimes it's a very stressful atmosphere environment at home. For instance, I tell you, one of the, a known colleague of mine, he was narrating one of the child in DPS says that requested his class teacher, ma'am, don't pressurize me to put on the camera. Please, ma'am, try to understand. Then teacher called him separately and tried to find out why. He said, right from the morning, my parents start quarreling, and we are in a 2-bedroom house. And in 1 bedroom, they are quarreling. And if I put on the camera and all, you'll see those things. I don't want to be humiliated. Please save me from getting humiliated. That is just a story, not a story in isolation. It's a common thing happening to many of the children. And that's adding to the mental agony of the children. And as you mentioned, digital divide has caused a huge, some around 3 to 4 trillion hours of learning loss. That's what UNESCO has calculated. About 3 trillion hours of learning loss has happened. And let alone when we talk of tribal and vulnerable group, it's in a very pathetic situation. Well, wash is an area which has been able to make some dent, because for years we have been promoting about washing hand with soap, but what we found that COVID has indeed induced that behavior of at least sanitizing, if not washing hands with soap, but using sanitizer, which has a negative effect, but at least cleaning up your hands. And that has led to lesser visit to the doctors, because you are not falling sick the way children used to fall sick. So lesser visit to the doctors is happening. But from the wash perspective, hygiene behavior, it has made an impact. But solid waste management continues to be a big challenge. What do you do with the mask used by an COVID-affected person? How safely it is disposed? How safely the items used by the COVID-affected people are disposed? It continues to be a challenge. So solid waste management is a challenge. And the major one area which all of you have spoken about is an area of child protection. When the lockdown happened, we thought that, okay, it has provided a time where parents and children are going to be together, spend that quality time, which was a rare resource in any household, where parents don't have time for children, and it's not happening. They can be together. But alas, what happened? It led to more sexual abuses, it led to more physical abuses, and children were the worst victim. It led to high number of child marriage. And I'm talking about child marriage in a state like Tamil Nadu, which had one of the lowest child marriages, Kerala, lowest child marriages, the child marriages going up. And what are the proxy indicators? The teenage pregnancy, going up. So that is another problem, what we have said. Even the child labor, the children who do not have access to digital gadgets for attending classes, they go to the Malli shop. So, they start supporting their parents for those shops, or accompanying their parents to the cottage industries or different factories where their parents work. They also started working. The one area which has made the biggest impact is the area of mental health, which Nandini was mentioning about. The mental health has been severely affected, and what I'm pleased to note that at least when I was in 2019, when I was saying that in the next 15 years, in next 2 decades, the biggest challenge for children is going to be mental health. I was not given that much of, due attention was not given. People brushed aside, the policymakers especially brushed aside, oh, that's not going to be a major problem. Thanks to COVID, that mental health has finally got that recognition that it is a major problem which children are going to face, and we have to work on that. Because what we have also found that if you don't address it, like mental health is one form of the children with disability, and always in India, children with disability or people with disability always are invisible. Because we don't want to recognize those issues as a major issue which is affecting our society. Thanks to COVID, that it has got that recognition. And lastly, what I have seen is a major challenge where we need to have a more solid social protection programs from the government is related to the children who lost their parents to COVID, or children who are now single parents. So that is also a major area where government has to come forward. There is some 2,000 rupees, I think, per month for foster care. It is being given, but that is not enough. We have to see how the child is progressing. If it is the orphans, then you have to go. Government has a policy of following up with these children under the foster care to see how they are developing. If we do not follow up with these children, then it is going to be a major problem for us. And lastly, I can say that what experts feel that this third wave may slow down and the spikes may come down by mid of Feb or end of Feb. And by that time, more vaccination. Now the precaution dose, which is a booster dose, has started. The only solution what we see is vaccination, at least the 95% vaccination to create that herd immunity, go ahead, double vaccination, then the precaution vaccination and the vaccination for children. And I think by March, they will start the vaccination for 12 and above children, so that by the time our next session starts, all children are vaccinated and can be safe to go back to school. So I take this opportunity, Sachi, to thank you for organizing this brilliant roundtable discussion. Thanks to the panelists, Manjira, Sudha, Nandini, then Susan, Lashtriya, Padmapriya, all of you, thank you very much for coming forward at a short notice to attend this discussion. And I'm sure we are going to, Kaushik and his team are going to take note of all the views, points that you have shared, and we'll make use of it for our program implementation. Thank you very much.